But I really do not uh, promote use of oral contraceptive pills for too long, because it can affect the fertility in a way that, for example, I actually was working in as an extra thing in one of the egg banks when I actually was recruiting the egg donors for a brief time every week. I used to spend there, and I noticed that those young girls who are just egg donors, who haven't come to us as fertility patients or anything, who are actually here to donate eggs for the subfertile women, they have smaller ovaries because, and very quiet ovaries, I would say, just because they've been on pills for 8 years, 10 years. So, yes, very prolonged use of OC pills can probably affect the fertility in the short term, meaning the withdrawal of the pills will let the ovaries bounce back. So we used to basically stop the ovarian OC pills for 3 months for those egg donors. And that was in the protocol. If they were using it for more than 5 years, we wouldn't take the egg straight away because the same dose. So what happens actually is the OC pill does two things. So if a patient has been on OC pills for too long, the the actual outcome that we have seen when we stimulate these ovaries in the IVF, they take the two things happen. They take longer to respond to the same level, meaning, for example, another woman would take 10 to 12 days of injections. These women might need 15 to 16 days of injections. So the ovaries are very quiet. They are not responding very nicely. And the second thing is the total dose of injections required for such women was higher. So if another woman would respond adequately to say 225 units of gonadotropins, this woman might need 300 or more. So a long time use of OC pills would do these two things in the larger perspective.